Hello, this is Carrie Pallardy with New Cannabis Ventures. I am joined today by Kelly Ogilvie, CEO and co-founder of DeepCell Industries, a technology development company focused on the cannabis industry. Thank you, Kelly, for speaking with us today.
Good morning.
We can go ahead and dive into those questions. First off, I would love to have you tell us how you got involved in the cannabis industry.
Yes. So my sister, she has epilepsy and has struggled with pain and also addiction to opiates as a result of her surgeries from some of the different injuries she received from epilepsy. And so for many years, she struggled with an opioid addiction, and she's very public in talking about this now. But then, found a way to wean herself off of the opiates, but she dealt with chronic pain. And she didn't have a solution until one day I recommended to her she look at medical marijuana. And she did, and it totally changed her life. And that's been one of the driving motivations for me to get more involved in the industry. I first really had paid attention to the industry when I worked for Governor Jay Inslee. I served as one of his senior policy advisors, and the cannabis industry, when it was first emerging here in Washington, was in my policy portfolio. And I had an opportunity to see the industry, hear testimonials from the medical patients in the medical industry at the time, and then participate with some of the lawmakers and policymakers on helping craft some of the laws here in Washington state dealing with cannabis. And I think the regulators get a lot of flack here in Washington. But to be honest with you, Washington was state number 2. It was really early in the legalization push for recreational cannabis. And so I think the regulators were somewhat aggressive in trying to demonstrate to the federal government that the state would be compliant and be sort of best of breed or gold standard around cannabis. And so seeing all this, both from a personal side and professional side, I just saw a tremendous opportunity to make positive change in the world. And so I left the governor's office to join DeepCell Industries as their CEO and help with strategy and expansion of the business model.
Thanks for sharing that. Can you explain the business model of DeepCell?
Sure. So again, working in the government at the time, it was very clear where the lines were, and so we saw an opportunity to participate and have leverage to the cannabis industry without some of the same risks. And by risks, I mean if you touch the plant, you're subject to a whole wide variety of issues, one being the persistent and I think illogical federal prohibition on the plant as Schedule 1. You deal with taxation issues, meaning the IRS treats you differently than any other business. You pay a penalty tax called 280E. Many cannabis industry folks know about this terrible tax. You can't deduct things on taxes. You're regulated by state regulators. You're regulated by federal regulators. It's very difficult to touch the plant and be compliant with both state and federal law. And so we saw an opportunity to have leverage of the industry through a licensing and royalty model where we have exposure to the growth of the cannabis industry, to participate in the growth and innovation explosion in the cannabis industry without physically touching the material. So what we do is we develop technologies and products and brands. We go from concept to prototype through commercialization, sort of analysis. We find a manufacturer who actually has the property, plant, and equipment. We license them the technology. We train them how to make it. And then on the back end, once the product is manufactured, packaged, and distributed, we also focus on some of the end-user marketing in the form of advertisement, social media, whether it be T-shirts, coffee mugs, stickers, supporting our licensee sales efforts. So in a lot of ways, we modeled ourselves after Coca-Cola back in the day. So prior to, I think, the current sort of way in which Coca-Cola operates, they used to ship syrup to the local bottling plants owned by some other business. The local bottler would take the syrup, carbonate it, fill it with water, put it in the bottle, cap the bottle, ship it to market to the local retail stores. Coca-Cola didn't do any of that at one point. What they did was they shipped the syrup and they did the marketing. And so we're similar in a way where we're upstream and then far downstream. The component where the property, plant, and equipment lie, we don't touch any of that. And so really it's sort of like a division of responsibilities, and it's a really good fit for some of our partners because they cannot deduct R&D expenses, and we can. We're sort of like outsourced innovation for the cannabis market, and that's sort of the model we're working with right now.
That's fascinating. Can you tell us a little bit about the company's history? How many employees did the company start with, and how big is the team today?
Yeah, the startup started with 0 employees, obviously, and in the life cycle of many startups, the company has contractors, not actual employees. The company went from 0 to about 4 full-time plus interns, so maybe 8 or 9 people participating in the company at the time. We're sort of consistently around 4 full-time with a rotating cycle of interns. But we also have a large number of consultants who participate. And that's really the whole point, is we're trying to stay very light. And so, it's sort of interesting how I think people look at the size of a company based on employees. I think we're trying to tip that model over a bit and really have more assets under management per employee. So basically, we want less G&A, or general administrative expense, which is sort of the cost of humans and administrating a business, less G&A over more assets. And so when you think about that, that way we're able to keep our overall costs low and profitability or revenues high per asset. And per asset, I mean, say it's a brand like our Ruby cannabis edibles or topicals or whatever brand. Maybe it's a new wellness line we're coming out with. So by having as few G&A costs per different line we launch is one of our overall operating goals. And so I think that is maybe a structural sort of paradigm shift that I think needs to be understood when looking at our business versus saying, well, how many people do you have? And that being sort of a proxy for size and growth of business.
Absolutely. Now, you started in Washington. What states are you active in now?
Yeah, the company started primarily in the medical cannabis space at the very, very end of 2015, moved into the recreational cannabis space with a licensee. We're currently manufactured by Evergreen Herbal here in Washington State. On the CBD side of manufacturing, Lazarus Naturals is our manufacturer of CBD products. We have a licensee in California. Product has begun distribution on the CBD side into Arizona's medical market, and we're close to signing a deal for manufacturing and distribution with a partner in Oregon. So for 2018, so currently we're in Washington, California, and we're looking at a licensing deal for early 2018 in Oregon with distribution of products on the CBD side into Arizona and beyond. That's
great. Now, how have you expanded your product set, and what are you developing this year?
Yeah, thank you. That's a great question. So the primary focus of innovation started with ingredients, and that was the cannabis-infused sugar and the cannabis-infused salt. Now we have a cannabis-infused xylitol product, which is a sugar-free sweetener, and we focus on that for very specific reasons. We wanted to build out a category of platform ingredients. And by platform, I mean sugar and salt are the 2 most used ingredients in the world, and we wanted to focus on those because they've become a basis to launch a whole variety of innovative products. So the top-selling product that we developed on top of the sugar are called the Ruby Gems. And the Ruby Gems essentially are organic fruit plus the organic sugar and the cannabinoids. And the beauty of these things is because they're real fruit, when you put them in your mouth and you chew them, they're chewable candies or tablets, they sort of repolymerize in your mouth and become chewy like a fruit roll-up in your mouth. And so they're very popular here in Washington State, and we're looking at launching a CBD version of those in the next few weeks and also a launch into California. So it's one example of the products that sit on top of the sugar platform. The same thing goes for salt. We're looking at a variety of savory products that will sit on top of the salt platform, and so on and so forth. And so we're looking at the industry from these sort of platform ingredients and then building out product lines on top of the platform. So we're able to pyramid into a wide variety of innovation from a very solid foundation. And we filed a patent on the process by which we manufacture or the cannabinoids are crystallized within the structures like sugar and salt. We received that patent from the U.S. Patent Office in November of last year, so we're very proud about that. We've just filed 3 more patents on some new technologies. And so we started out with ingredients, and now we're moving and pivoting into sort of more complex human wellness types of applications of cannabinoids as we begin to understand sort of the amazing impact that the cannabinoid molecules have on the human body and the brain. I'm happy to talk about that a bit if you'd like.
Yes, please do.
So as we're learning more about how the cannabis plant affects the brain, it's becoming more clear that it isn't just about the THC or even the CBD molecule on the brain in different ratios. We're learning that the terpenes are psychoactive in nature. So let me give you an example. So the terpene or the flavor or aroma molecule that gives the cannabis its distinct, unique aroma. Maybe it smells like pine, or maybe it smells citrusy. These terpenes actually are not unique to cannabis. There is no unique cannabis terpene. I want to repeat that. There is no unique cannabis terpene. So every smell of a cannabis bud that you smell and you enjoy or a product, though that combination of smells is a composite of terpenes that exist elsewhere in nature. Maybe it's in a pine tree or a mango or a lemon. It's the unique combination of those terpenes that give that cannabis that unique smell. And we're learning that these unique profiles of compounds, whether it be certain cannabinoid profiles and ratios with the terpenes, are responsible for the different euphoric or different effects of different strains of cannabis. So in a lot of ways, the cannabis strains in the market are really just proxies for the different chemical profiles. And so we're beginning to examine what are the chemical profiles, how can we replicate those profiles, and do the strains of cannabis in different geographic areas actually give you the same effect? And we believe the answer is actually no. So for example, through some of our latest research, we've learned that maybe the blue dream in Washington and the chemical profile expressed on average here is actually very different than the chemical profile expressed in California. And so if you think that by smoking Blue Dream it makes you feel a certain way, it will depend on where you get it from. And so these are the types of insights that we're looking at to really begin to explore, okay, how do we address consumer preferences? How do we provide the consumer and even businesses the insights and the product sets to really give certainty, predictability, and the features that these users want, which will, I think, take cannabis to the next level. So we're placing our bets on a wide variety of products, whether it be technology, innovation in terms of understanding the terpene profiles, whether it be gut health. We're looking at topical applications that are highly functional, not just sort of fire and forget dumb missiles. That's not a pejorative statement to what's in the industry now, but I think really understanding the activity of these compounds, whether it be in the brain, the body, or on the top of the skin, are really important in the next leg of the mass market appeal of these products.
Those are certainly a lot of fascinating avenues to explore. Now, you mentioned earlier that DeepCell has a unique business model. Can you tell us some of the biggest challenges the company faces?
Yeah, that right. Always sunshine and rainbows, right? I mean, it's challenging sometimes when you don't control or have a hand in the manufacturing, speed, control over manufacturing processes, quality control, timing, ingredient set. These are all things that we don't do, and so as a result, there can be a culture fit or misfit sometimes, and it takes time to work out how to work with a partner depending on their systems or their workflow of how their operations work. And really, every partner is different, and so it's almost having to go through this process every time with a new partner in terms of sort of the socialization of the culture fit, the training of how to make the products, the packaging, the quality control, expectations of delivery. These things have to happen from the beginning to end every single time over and over again. So we're getting better at it, but it definitely is a challenge because if it were as simple as like reading a book and taking a test or reading instructions, it'd be easy. But it's not, because businesses are fundamentally about people. And therein lies, I think, the opportunity and the challenge. And so it's a personnel, I think, challenge we face. It's a control challenge we face. And also it's a margin challenge we face. We don't capture the lion's share of the margin. Our deals range anywhere from 20 to 40% of royalty based on the margin and the product. And as a result, we need volume and distribution in order to make our model work. And so for us, the operating mantra is mighty are the empires that expands. We need to expand our licensee base, expand our portfolio of product set to generate new cash streams into the company. So that's the structural challenge we face, and sort of the business biological imperative is expansion. And on the actual operations side, when you don't control manufacturing, there's always a risk of there being sort of miscommunications and delays.
Absolutely. Now, switching tracks a little bit, have you raised external capital? If so, can you tell us about that?
Yeah, we've raised about $850,000 to date. We're close to closing out. The balance will raise a total $1 million seed. We're actually beginning discussions with some firms on our Series A, like literally as we speak. And so we hope to close our Series A in the next maybe 3 to 6 months, sort of the natural life cycle of a Series A. And we're shooting anywhere from 5 to 10 mil for our Series A. And so if there are any venture firms who are interested in our model listening, we're certainly open to a conversation at this point.
That's exciting news. Now, speaking of expansion, have you explored any international markets or thought about doing so?
We are most certainly exploring that opportunity. And let me sort of share the thinking. Canada obviously is the big target for lots of companies because it's a large federally regulated market right to our north. It's just pretty easy for us to get there. The challenge is just the way in which that market's being structured. So as we all know, we believe that the market in Canada will open in summer of 2018. Some people think July. We think a little bit later is more likely. And then edibles and other sort of innovative products, concentrates, won't be really allowable until 2019. But planning for that eventuality, I think, is really important on the front end. And so we're beginning to look at partners now and explore the Canadian market, and then using the Canadian market as a platform for export into the European markets. We believe Western Europe is an untapped opportunity. Germany, Spain, France, Ireland, I mean, these markets that are allowing medical, or going to allow medical markets, I think could be a tremendous area of demand for innovative branded products and platform ingredients. And so our goal for 2019 is Canada and Western Europe. We currently are not exploring opportunities in South America or other places, not for any other reason beyond just market size. We think mature economies are really pretty safe bets for medical cannabis.
That certainly makes sense. Well, Kelly, thank you for speaking with us today. We look forward to tracking DeepCell Industries' growth in the future.